Hello, I'm back. Sorry for being a little bit late, but now in this month I'm going to present another another case which has very important diagnostic implications, and this is a 50-year-old male with an abdominal mass. As you see, we have a very cellular multinodular tumor infiltrating fat, and when we just look at those areas with hypercellular areas, we can appreciate that these areas are composed of inflammatory cells. And let's come closer. And as you see, a lot of neutrophils and mixed inflammatory reaction, and between those cells we have some uglier looking cells. It's full of neutrophils and plasma cells, and we have some mitotic figures and some cells looks like plasma cells, mast cells, and with the binucleation and hyperchromasia. Here, another one here with large cytoplasm, and some of them looks like rich Schomburg cells. And in this kind of situation, we have a differential diagnosis of lymphoma, but this is not in a lymph node here. Again, we have this kind of more uglier cells, and within the lymphoma, we have a Hodgkin's lymphoma, or anaplastic large cell lymphoma, or diffuse large B-cell lymphomas. But it's always, one have to be careful with an intra-abdominal lesion, and it's always good to see the periphery. If I show you the whole lesion is composed of 90% of these inflammatory type. But if you look at the periphery of the lesion, within those mature fat cells, we encounter the same hyperchromatic cells within the thick septae, and this is the best area of this case here. Again, we have these multilobular hyperchromatic cells that are diagnostic for liposarcoma. Again, some cells with more vesicular nuclei also exist. Of course, we did some stains to exclude the possibility of lymphoma, and this is CD20. CD20 has some large, just stained some larger cells, as you see here. It stained some larger cells, but the rest of the neoplastic cells were negative, as shown here. And CD30 was also negative, just staining some scattered immunoblasts, but our neoplastic cells were also negative. EBER was negative, and we ordered CDK4. Personally, I don't like these stains, these two stains like MDM2 and CDK4, but they help sometimes, as we see here, nuclear staining. It also uncovers the lipoplastic nature of these cells. And MDM2 was also positive in some of those cells, as seen here. So we did a confirmatory FISH in order to give the diagnosis of liposarcoma inflammatory variant, and it turns out to be amplified, as seen here. This is a paper for the seminal paper for the use of MDM2 and CDK4 for the diagnosis of liposarcoma with the French group, and it's in this paper it was quite sensitive and specific. Actually, if you use both together, it's the best. But after that, several papers emerged that the use of it, telling the use of the MDM2 MCDK4 by immunohistochemistry can be misleading. So some people prefer to use MDM2 FISH, and actually to our experience, MDM2 FISH is quite better than MDM2 and CDK4. But just to again to emphasize that if you see lymphoma-like lesion intra-abdominal, just don't forget to look at the periphery, and just you have to memorize the possibility of inflammatory variant, a well-differentiated liposarcoma. Thank you for watching us, and see you the next time.